I use she, her pronouns, and I live in Boston. I have been a patient at Fenway Health for almost 30 years. I started when the building was on Haviland, so it was a much different space, smaller, right? Like a third of the size. And I had moved to Boston in the late 90s as a lesbian. And, in your 20s, you drift around. I drift around the country and did not have any regular PCP or provider. I don't remember going to the doctor with any level of frequency or regularity, but upon moving here and not roaming anymore, and wanting to be a grown-up, I thought I should get a primary care provider. So I did, and it was a family practice in Somerville where I was living at the time. And it's hard to imagine now, but there was a time where providers having any sense of sexual orientation or gender identity that was not, your identity was not what you appeared to be, and you weren't straight, was very much the norm. And I went in for a regular checkup, like an annual exam. The nurse practitioner who saw me was lovely, but she was really confused as to why I was not on birth control, but sexually active. And so in that moment, I felt incredibly vulnerable, right? Like, you're a young person. It was like Ellen had just come out on TV, so being LGBTQ was not as socially acceptable as it is now. And so you're like in a paper cloth gown, right? And you're like having to then break down your sexual orientation to someone who's going to examine your body just doesn't always feel great and safe. Shortly thereafter, learned about the Fenway and made the switch over. I feel like the care has always been inclusive, and my providers think above and beyond whatever I'm coming in for. So, for example, now like 15 plus years ago, we were trying to have babies and thinking about what it means to reproduce as, LGBTQ folks. So you utilized, I think it was called the artificial insemination program back then. I don't know what it's called now, but there was a lot of education that program provided. There were services. Erin Gately and Liz Coolidge were like pioneers in helping us, all these lesbians, try and get pregnant. We used to joke the old-fashioned way. And so did a lot of IUIs and felt like everyone cared and was invested in that journey. And I feel like the care, like as we were just saying, like things have evolved for LGBTQ people. Boston has evolved, right? When marriage equality was legal here, but not in the rest of the country, I remember Fenway would do programming that would help us understand our rights as parents and what the implications were. So I feel like Fenway continually tries to meet the moment, right? Like with gender affirming care, what it means to make PrEP available. Like every time there's been a shift in our culture, whether here in Massachusetts or nationally, there has been like Fenway as a global taking care of all of us, all of the pieces of us, has attempted to meet the moment. And I feel like that I've experienced that as a patient and as a member of the LGBTQ community. I am a huge fan of how the pharmacy delivers. And so I live in Hyde Park, so a neighborhood in the city. And so when on my neighborhood Facebook chat pages, people are like, I need a new pharmacy, I always refer folks to Fenway Pharmacy, right? It delivers, it's fantastic. And what I try and tell people is Fenway is not just for LGBTQ people. And I think that is representative of Fenway writ large, right? Like I think LGBTQ folks know Fenway. That is like where we can go to get what we need. But there's so many things you all do, whether it's the free delivery service in the pharmacy, whether it's blood draws, right? Like, and you're based in communities, neighborhoods that are accessible to lots of other Bostonians. And so folks should be taking advantage of it, right? Like, and the folks at the front desk are lovely. I think overall it's a great experience.